Welcome back. Throughout the week, the topic of Medicaid expansion has sparked a big debate at the state capitol. A few of the most outspoken people on the issue join us in the studio today. Peggy Venable is the Texas State Director for Americans for Prosperity, and Dunkelberg is the Associate Director of the Center for Public Policy Priorities. Welcome. So this has been a big week for the Medicaid expansion debate. We started on Monday with all the events surrounding Governor Perry's group and then the Democrat response afterward. Now we have been recently seeing it in the House budget talks. What exactly happened there at the House? Because I know it kind of started to look like it was going to go through in some form or fashion, but then it got pulled back. Can you kind of explain that to me, Peggy?
Well, I understand, and I wasn't watching the whole thing, but I understand when the Medicaid expansion amendment to the appropriations bill came up, that some people said that they didn't realize what the vote was. Sometimes when it is a vote to either to adopt the amendment or to table the amendment, some people will claim they just didn't know which they were voting on. So it actually was voted, the first vote was to move to expand Medicaid, to provide the funds to do that. And then one of the members who voted for it, because it has to be a member who votes for it, came forward and said that they wanted to readdress that issue. It came up again, and then it was defeated. And I had members calling me saying, I didn't mean to vote for it. I went back to the, immediately changed my vote. So I think a lot of people were very concerned about how their vote came down on that. And as it turned out, it was not a vote to expand Medicaid, but there was certainly an effort there. Was that really kind of what was happening behind the scenes, or do you feel like maybe they got some pressure after they made that vote?
I think the takeaway from this whole week is that there are an enormous number of conservatives and Republicans, not just in Texas and in the legislature, but across the country, as we've witnessed a number of Republican governors moving ahead with a customized version of Medicaid expansion for their state. Same thing is happening in our legislature. The amendment that came up was almost identical to an amendment drafted by Senator Tommy Williams, the very conservative chair of the Senate Finance Committee. And as she noted, it is not an amendment that directs that Medicaid expansion will happen. It's one that says if we do it, it has to encompass these dozen or so conservative principles. And I think the big takeaway that everyone should have from this week's activities on both sides of the aisle is it's absolutely crystal clear that conservative states and conservative governors can work with the federal governments to cut a deal, to do this in a way that they're comfortable with according to their principles. And if we don't get there in Texas, it will only be because somebody doesn't want to get there. There's nothing standing in our way.
Have you been hearing that there are going to actually be any talks about negotiating with the federal government from Perry's administration?
Well, I think early on this administration has asked for waivers and is looking for ways that they can fashion a Medicaid expansion program that might work for Texas. But as it is, if it's a one-size-fits-all, it's going to be administered by Texas but directed out of Washington. If we're supposed to put up even a portion of the funds, and even with the feds paying much more, we have great concern about whether or not those federal dollars will be able to continue. And why put more people on the Titanic? This is a program that isn't working. Even Obama has said it's a program that's not working. Why should we expand a program that's not working and put more of those people on this program that essentially is destined to fail?
If the money was given to Texas to do something like that, I know some of the concerns from the Democratic side is that maybe Texas wouldn't use the money the way that it should be.
This is not a block grant. This is like Medicare or our existing Medicaid program, in that basically it's just going to be federal financing with a state partnership after the first 3 years in that financing to get people insurance. So it's not like they give you a block grant and you get to go spend it however you want. You prove to them that you provided people with health coverage and they help pay part of the bill. So the important thing is that we take that money and actually provide people coverage. And the conservative option that's being pursued by states like Arkansas is the feds have said, we are so willing to be flexible that we will let you put these new adults who aren't covered in Texas into the health insurance exchange and let them have private insurance instead, if that's your preference, if you don't want to put them into the Medicaid system. So again, I think the evidence is there that the feds are willing to work with conservative states and let them customize this program. And again, if Texas doesn't get there, it won't be because the flexibility wasn't there.
I thought you were just shaking your head over here.
I was. We have a state chapter in Arizona, and we don't see that being the case. It's not really the flexibility they anticipated they might be able to get from it. I think we're just going to stand firm and simply say we shouldn't expand Medicaid. We believe that Obamacare itself, the Affordable Care Act, hasn't really been affordable and hasn't given more care to citizens. We're seeing more and more businesses drop health insurance. We remember that Obama had said if you like your health insurance, you can keep it, that you'll save $2,500 on your premiums a year with Obamacare, and it's costing $3,000 more a year. More and more people are losing their health insurance. We think this is the wrong way to go.
And you say?
Well, one thing I would say is that a lot of misleading information has come out of Arizona. For example, they've talked about the fact that employer-sponsored care declined there. The only state in the entire United States that hasn't lost employer-sponsored care over the last decade is, guess what? Massachusetts. So basically, we have lots of options for more affordable care under the Affordable Care Act. The Congressional Budget Office has actually, our state demographer, Steve Murdoch, who was also the head of the U.S. Census, has estimated that with just medium enrollment under the Affordable Care Act, we would cover about half of the uninsured in Texas in the first 2 to 3 years. So while I understand that ideologically, Ms. Venable's group does not believe that there's an appropriate role for government in health care. They are in many cases opposed even to the existence of Medicare. We simply disagree on principle. We don't think that there is a way to get affordable coverage to every American, not for free, but at a price they can afford and with the guarantee that they won't be bankrupted by health care costs. That there has to be a role for government in it to make it affordable for everyone.
Well, no doubt this conversation is going to continue for the rest of the session and even after. I thank you both for being with us today. And moving on, our political roundtable of journalists will be up right after the break. Thanks for staying with In Session In Depth.